Dear friends, welcome to Fasting and Healthy Living. Today's topic is about dietary fiber. We talk a lot about dietary fiber when we eat food, like there's a lot of different components in it. Are these fibers equal? And I just wanted to put the dietary recommendations, how much it is, and what are the difference between soluble fiber and insoluble fiber. Let's start with what are the fiber content. So when we eat, there's like fibrous substance in vegetables, in fruits, in nuts, almonds. They are like component of the food which makes it fuller, which keeps you feel fuller. So there are different kinds of fiber. One is soluble fiber and the other one is insoluble fiber. Not all these fibers are actually equal. Soluble fibers are dissolvable in water, so it is called soluble fiber. Insoluble doesn't dissolve in water. And what are your daily requirement? With 30 to 35 grams of fiber every day will keep you healthy, so that you will have enough bowel movement, you will have no cardiovascular disease, you will not have diabetes if you include 35 grams of fiber every day. So the fiber recommendations are that. And let's dig into soluble fiber and insoluble fiber. When we understand about soluble fiber and insoluble fiber, it makes it clear to us why it is making like some soluble fiber will cause you gas in the body, some makes you constipated, some makes you go bathroom more often, why it is. So let's first take soluble fiber. Soluble fiber is always dissolves in water. So when you eat it, it dissolves, it digests in your stomach, it makes into gel or any other form. And it can form gel in your body, like when it gets into your stomach. For example, chia seeds, when you put it in water, you see some gel substance in it. That's a soluble fiber. If you put oats or cook oats, you'll see gel-like substance forming or get thickening. It is actually a soluble fiber. So they are digested by our gut bacteria. So the gut bacteria actually changes into short chain fatty acids. We have already talked about it in gut microbiome video. Short chain fatty acids like acetate, butyrate, which helps your gut microbiome, or they are the food for the gut microbiome. So always short chain fatty acids are good for your body. They are the fuel for your body, that is energy for your body. And they actually convert into pectins, gums or hemicellulose. So what the soluble fiber, they go into the body, they become a gel-like substance and they are converted to pectins or these kind of substances. Let's see what are the most common soluble fibers which we can get. Maximum ones are like oats. Oats have 16 gram of fiber. Barley has 13 gram of fiber. Chickpea, every day if you eat chickpea, a bowl will give you 12 gram of fiber. Lentils, including lentils, is very good, which is 15 gram of fiber. Quinoa, 5 gram of fiber. Kidney beans, 11 gram of fiber. Avocado, 13 gram of fiber. They have both soluble as well as insoluble. Beets has 4 gram of fiber. Apples, the skin of apples is really good too. They have 4 gram of fiber. Blueberry, pear, strawberry, raspberry, banana, everything has 3 to 8 grams of fiber. Chia seeds is a maximum, that is 10 gram. Almonds, all the nuts have like fiber, insoluble fiber as well as soluble fiber in there. Soluble fiber. So what is the benefits of including soluble fiber in your diet is decrease the cholesterol levels. There is a decrease in LDL. Most of the people complain about cholesterol high, especially LDL, the bad cholesterol high. How you can tackle it? Adding soluble fiber in your diet every day. Your content should be 30 gram. That was LDL cholesterol will lower, because the LDL cholesterol is higher because the body actually accumulates the cholesterol which is not transported out through your bloodstream. So that's the reason why LDL cholesterol is high. So by adding soluble fiber, you can get the cholesterol down to normal level. The risk of diabetes. The risk is much higher when you don't treat your food, like, where you have to ratio your carbs, your ratio your fat, your ratio your protein, and including your fiber. So when you have the ratio added to your food, then the risk of diabetes is going lower. So these are the especially soluble fiber. These are the list of it, and let's go into insoluble fiber. Insoluble fiber, as it says, it doesn't dissolve. It goes into your stomach. The stomach can't convert into anything. It doesn't form any gel. There is no gut bacterial activity. They form bulk in your body, and it can actually convert to cellulose, some hemicellulose and lignins. Celery is the best example for lignins. It's so like you see that fibrous content in celery that is actually is very good. It will actually form bulk in your intestine. And this can make you feel fuller. If people like you're more hunger or anything, it will increase your satiety. You can have more of these insoluble fiber. So you can have rye, brown, broccoli, celery, corn, veggies, brown rice. So especially for example corn. Corn, if you eat it, you know that the stomach doesn't digest corn. When you poop, you see corn because the corn is not digested in your stomach. So that is an example for insoluble fiber. And it's good for gut health too, because the bulk forming content in your intestine will clean out like a bulk form when you add water. What it does is, those who are constipated, if you add these things to your diet, your constipation will be relieved. So you can have a diarrhea or it will push it out. So that's why this is recommended for people who have constipation or constant constipation issues. And they also pull the toxins out. People who really have issues with any toxic overload in their gut, this is the best way to tackle it, by pulling the toxins out through the insoluble fiber. Especially when you have psyllium or polyethylene glycol, these kind of things actually are bulk fibers which will clean you out through your gut. So let's see how we are ratioing our food as well as our fibers.